Hello from the Royal Society of Medicine here at 1 Wimpole Street in London. I'm sorry that we're not able to welcome you in person for your annual conference and AGM. I think it's fair to say we're all having to find new ways of working, and that is certainly true for organisations and individuals involved in medical education, training, and the provision of information and support. The pandemic has certainly presented us all with challenges, but it has also opened up a whole new range of ways to connect with people, and it's allowed organisations to significantly extend their reach and their impact. I know that new ways of working is the theme for Behçet's UK today, and that you have some great sessions planned, particularly around the vital importance of patient data. I also know that you are currently undertaking work on developing a set of research priorities for Behçet's, and that you'll be bringing together the questions that patients and clinicians want answers for. A few years ago, I was involved in the development of the Sight Loss and Vision Priority Setting Partnership. And this exercise not only helped focus research on what matters most to patients, but it also produced significant benefits of bringing together new collaborations to deliver that research. So it's an incredibly important exercise. Now, I know that we at the Royal Society of Medicine are very much looking forward to collaborating with Tony and all of you on delivering a programme under our Medicine and Me series. This will bring together people with Behçet's, clinicians and researchers. And we're very much looking forward to being able to welcome you here for that programme. In the meantime, I wish you a very successful conference today.
Good morning. Following Michele's most pertinent introduction for the theme of today, I also offer a very warm welcome to our Behçet's UK 2020 conference and annual general meeting. I am most grateful for the support we have had from the Royal Society of Medicine to host this event, facilitated by excellent help from 1 Wimpole Street. I'm Tony Thornburn, Chair of Behçet's UK since September 2017. 164 other people have registered today, of which 44 are joining us from abroad. And I particularly welcome you from all over the world, so undoubtedly a rather different set of timings of day and night to us in the UK. The summary of the proceedings can be reviewed by everyone in slower time, online for 30 days. So my overall message for the day is well summarised here. And I would suggest that this applies over the world as far as Behçet's is concerned. I'm hoping where the International Society for Behçet's disease is concerned, and the patient day that ordinarily accompanies during their biannual conference, that we can encourage closer working with international patient and advocacy groups wherever they exist. You've seen the programme, which has not materially changed. And I take this opportunity to thank all our panellists for giving up their valuable time today to help us. We start with the importance of patient data, followed by a brief AGM, 20 minutes or so, and then we segue to the topic of improving patient outcomes. Rachael Humphreys will then present the results of a fantastic joint fundraising initiative. Over the lunch break, a 40-minute film will run a couple of times, focusing on exploring the frustrating issue of the patient diagnostic odyssey. So once you've had a break, if you want to come and listen to that, I would commend it to you. After lunch, we continue with the theme of assisting diagnosis from a GP's perspective. And then we have the all-important Centre of Excellence section, followed by our ever-popular medical advisory panel question and answer session. I would just like to emphasize question and answer protocol. Best to ask questions in general terms without excessive personalization. Please do not name individuals, clinicians, specific health practices, etc. In that event, we will just moderate them out, I'm afraid. If we cannot answer every question today, we will do our utmost to subsequently get back to you with an answer. Gemma and Deborah are beavering away in the background to help me manage the questions. The Q&A function is at the bottom of your screen. If you hover there, you can upvote questions that you like, endorse, or find most pertinent. You will need to scroll up and down as questions change over time as new ones are added. This is Victor, who has been assiduously helping drawing this program together for us, and Sean is in the background somewhere too. I asked Victor to send a picture of what the participants will see on their screens, so I could show you. So this may come as a slight surprise to him. So without further ado, I'll hand over to Rick Thompson, who's the CEO of Findacure, a fantastic organisation who support the rare disease community with many resources and ideas from which Behçet's UK benefit, and indeed many other rare disease partners. I commend this first session to you. Whilst it is not about Behçet's, it demonstrates what can be achieved when everyone works together and regarding the optimal use of patient data. We have the benefit of the Centres of Excellence, only in England, mind you, and we must take advantage of that. Dr. Priyanka Chandrata's talk in the afternoon will highlight an initiative which helps to start that process, which has been match funded by Behçet's UK. Rick, over to you, please.